Well, hello, my friends, and welcome back to Ending Physician Overwhelm. Once again, I am so pleased to have your ears for the next little bit of time. So, today we're going to be talking about boundaries around other people's messes. And I was preparing for the episode and sort of thinking through a couple of experiences I was involved with this week and my own thoughts about it. And just thinking about you as the listener, I bet you can come up with at least 5 examples without giving this much thought of times when you have been called in to clean up other people's messes. So we're going to dive in today, and this is going to be an episode where I invite you to really think about what's going on currently for you. Where are you over functioning in this capacity, and what's the impact of that for yourself and for other people? And what is the low-hanging fruit where you can get started in setting some boundaries so that you are no longer cleaning up other people's messes, feeling fully responsible, you're giving other people opportunities to do their own work. And we're going to talk all about it. So join in. Of course, it really depends when we are thinking about boundaries around other people's messes. What are the circumstances? If you have little kids or if you have teenagers, right, there's a big difference in what cleaning up messes looks like. If you are someone who employs people, right, if you have staff, if you run your own clinic, if you have your own business of some kind, if you are responsible for leading your clinical team, that's going to look different than if you're fully employed and you really don't have any skin in the game in terms of other people's performances. It matters, how do you interact with your colleagues? I think it matters, are you primary care in a large multi-specialty group? Are you a specialist? Are you a super subspecialist who, fixes a very narrow niche? This is going to look different for all of us. So again, as I'm talking and sharing ideas and examples, I want you to think, what makes sense for me in my life when I think about boundaries and other people's messes? So this topic came to me this week because I had not one, but 2 instances, and I'm not going to share a whole lot of details. One was related to a patient of mine who saw my colleague for an acute issue. My colleague ordered an advanced imaging study, ordered an MRI, but did so in a way, it was kind of through a secondary system so that none of us could see what had been ordered, what had been sent, what codes had been used. It was all kind of done through a secondary portal. The patient was getting on the schedule for this test, but the place where he was going to have the test done didn't have sufficient information to be able to get insurance authorization. And so there was just a ton of back and forth between the offices. And to be quite frank, we heard a lot of different stories about it. Yes, it was approved. No, it was approved. Ultimately, it was not approved. I happened to see the patient for his wellness exam on a day in the afternoon when we thought the test was scheduled for the next day and then it had been approved. Unfortunately, over the course of later that afternoon, we found out it wasn't approved. It was just this whole big mess. And the mess that I was involved with was trying to make sure that ultimately we serve the patient, that we take care of him, that we get his needs met. But meanwhile, there was just lots of confusion and anger and frustration at the way this had all unfolded. And I couldn't help but just reflecting, my immediate thought was, man, if my patient had only seen me first, this mess would not have happened. And that's a common thought, and I think it's a common thought and situation that many of us had, right? If I had been involved from the start, none of this would have happened. Raise your hand if you are with me, right? There's so many instances I can think of where, man, if somebody had just asked me first, this wouldn't have happened. The problem with that though, is that when we think that, we are sort of signing ourselves up to be the person who is fully responsible for all of the issues, right? I work part-time in my medical practice, so I am not there all the time, and neither are you. Even if you work full-time, you get sick sometimes, you have other people get sick sometimes in your family that you need to take time off. You go to educational conferences, you go on vacations. There's the weekend, hopefully, that you get, and you get to rest. There are lots of times when we are not 100% available for all of the things that a human experiences. And if you work as a surgeon, right, and you're on call for someone during the time that they are in the hospital and, you know, in sort of your acute hands, that's one way that it looks. If you're primary care, then you've got people who are attached to you by name. Your name is on their chart, sometimes accurately and sometimes not accurately. But that means that a lot of things filter towards you. I want you to ask yourself right now, is it reasonable for you to expect yourself to be first call for all of the issues that happen with all of your patients? 100% no. So when I had that thought, man, if he had only come to see me first, none of this would have happened. We would have already been down a different pathway. I had to take a pause, take a breath, and say, it's not reasonable for me to expect that I'm the only one who provides these patients care 100% of the time. I'm grateful that my patient was able to be seen, and I am going to make sure that he gets the care now that he needs. So I am going to step in now and fix the problem. Although I was very clear to say what did and did not go correctly to the patient, so that, you know, it's just clear. And I really wasn't casting blame, but there were kind of multiple errors that happened along the way, some of which was on our side as a clinic, some of which was on the radiology department side. It was just kind of a mix of things. But I'm gonna take responsibility for moving forward, and I'm not gonna blame myself for not being involved now. Now that is boundaries work that I have done over time. But you can see I still get the message from my immediate sort of, you know, reactive brain that says, oh, you should have been involved from the beginning. I know that some of you listening know exactly what I'm talking about, because this is something that comes up when I coach clients all the time. And this is something that comes up when I just have casual discussions with any physicians anywhere, and we are talking about our frustrations. There are so many instances like this. It comes up too when there is some kind of a decision that someone on the clinical team made at some point that you would have done differently, but you weren't involved at that step, right? A schedule mistake or just a schedule difference. You would have scheduled them differently if you had the information up front. Again, we do not have the time or bandwidth to be involved 100% of the time and 100% along the way. And I want you to really ask yourself, do I really think that's reasonable, that I should be involved when the patient schedules an appointment? Trying to find a spot on the schedule that makes sense. None of this. We can't do it. We cannot do it. I don't think that there was ever a time when that was reasonable to expect that we would do that 100% of the time. I think it's lovely when somebody on the team can recognize, oh, there's something special going on, and I'm going to go and talk to that human, right? They're going to come talk to me and ask me because something has triggered, oh, this might be a different situation than usual. But it's just not feasible for us to have complete control there, right? We were talking last week about control versus freedom. We will not have 100% control, and I don't think that most of us really want that. We just get tired of cleaning up other people's messes. There are going to be times as well when you are the only person who can fix something. So our medical training is such that there are going to be times where your level of licensure, your level of skill or expertise, especially if you're, a specialist, and especially if you're a very niche subspecialist, right? There may be situations where you are the only person who really understands and knows what is necessary. Generally speaking, that's going to be a relatively small amount of the time, and I'm going to dive into that in a little bit more detail. But it's very easy for us to trace the line that because we have been sort of niched up, even if you're a primary care provider, right? If you're a primary care physician, you have advanced knowledge and you lead the team, even if you are employed, right? And you don't actually oversee anyone, your level of licensure is up at the peak. And because of that, there are just some things that only you can make decisions about, or only you have the skills, knowledge, expertise to solve. But it's very easy for us with our problem-solving brains to look back at all the other decisions that have been made, whether by colleagues, whether by staff, whether by the patient, and be able to see all of the instances where you would have made a different decision. And because you can see all of those things, it's very easy for you to think, man, I should have been involved at point X, Y, and Z. I could have cleaned this up, right? And to feel responsible, therefore, in a way that probably isn't fair or reasonable and doesn't really make sense. Raise your hand again, right? If I'm talking to you, do you take on an undue level of responsibility for other people's decisions, choices? I think, again, in primary care, we often get blamed for whether or not someone's chronic diseases are well managed. So do your patients have, higher blood pressure than we would like their goal to be when they come in, and it's documented in the chart? Is their A1C higher than whatever cutoff, HEDIS metric type thing? We often get blamed. And it's put up on charts on the wall, or charts when you log into the electronic medical record, especially if you're on Epic, you know what I mean, where we've got reds and greens. We interpret that as blame. And really, we need to see ourselves as expert consultants who have the ability to influence people's health, but we do not fully run and manage so many parts of their existence that are relevant here. I was talking with someone who is a surgical subspecialist that specializes in, pretty complex cancer-related surgeries. She happens to live and operate in an area of the country where there is a large cancer burden with the particular kinds of cancers that she treats. And a lot of that is related to environmental and occupational exposures, lifestyle measures like tobacco use, alcohol use, any number of other sort of factors go into that. And it's very easy when you are the person who is expert in treating the really bad stuff that happens to people's bodies when they're exposed to so many of those chemicals, and carcinogens. It's very easy to think, I am fully responsible for these people's disease. It's not true, and that thinking is so tough to get out of our heads because we have been trained to take on such high levels of responsibility. It's absolutely true that she has the knowledge, skills, and expertise to provide excellent care for the advanced cancers that she sees. That is 100% true. But is it reasonable to expect her to be fully responsible for the volume of these complex patients? No, because there's a huge volume. This is something that comes up quite frequently for us as well, and really feeds into moral injury, right? If you are very skilled and knowledgeable and expert on certain medical conditions, or just, you're just an excellent primary care physician, and there is an undue burden, right? There are too many patients who need or want your skills and expertise. So many of us flip into overfunction mode for years because we feel like we have no choice, right? We know that we can help people. We know we have the knowledge, skills, and expertise to do it. And most of the time, we also know that we do not have the capacity to be able to meet the needs of so many people. Think about really over-paneled primary care physicians, right? Somebody who's not on your panel comes in, they share a story, you resonate with them, you know that you can provide them the exact kind of care and the quality of care that they deserve, right? I'm speaking to all of my, I'm gonna lovingly call you my bleeding heart primary care physicians. I'm with you, I know you, I love you, I am you, right? But you hear their story and you think, I could take such better care of you than you are getting right now, right? We have a desire to rescue them from the mess that they're in, and we already know that we are already over-paneled, that we already have too many patients that we provide this same high level quality of care. And if it's not harming us, that's fine. But many of us are drowning. We are drowning. We are sacrificing ourselves and our needs and our wants over and over and over again. It's really important that we understand this piece. There is moral injury here, right? To look and to see, I have the capacity, I have the ability, I'm going to say, I'm going to have the ability to help this person, right? I have the ability to provide them with excellent care, and I don't have the capacity other than continuing to squeeze myself harder and harder, which has very big implications on our health, our sleep, our relationships. All of those things are important, right? But when we have that moral injury piece, right? When we have that ability to see that this person is suffering and I could relieve it, but it's going to take me taking on some suffering, you can see why we end up making the choices over and over and over again that we make at the harm of ourselves. It's very hard to change that pattern. It's doable, but there's some cost there too, and I want to acknowledge that. When I'm working with someone to make changes here, to have us acknowledge that there is a need. There is a need for the wonderful care that they provide. And it's not reasonable to have not enough of you to be able to take care of the volume of patients that are going on. It's not reasonable for you to sacrifice years and years and years, to sacrifice your health, your important relationships, the ability to go and have fun and rest, right? Like normal humans. It's not reasonable, but we have to see that the burden, the number of patients who need your skills and expertise is not your mess. It's not your mess. It's the system's mess. It's the big healthcare system's mess. It's your immediate healthcare system's mess. And we so often take on this burden of thinking, if I don't say yes here, if I don't sacrifice, if I say no, right, then the suffering continues. And yes, that's true for an individual patient. But unfortunately, we reinforce that the system is working just fine when we continue to add to our own suffering in order to relieve the suffering of others. This is not easy stuff, right? It's not easy stuff to set boundaries. This is a big mess. right? That happens a lot. But again, I want you to see that it's costing us. It's costing us quite a bit. We need to be able to recognize what is going on, to be able to take care of ourselves. The training we receive in sacrificing our sleep, our time with family, our autonomy, that is not intended to be indefinite. None of us would sign up for that, right? You can't continue to sacrifice your needs and wants for years and years and years and continue to be a happy, healthy human. Show me an example. It's not true. It's just not possible. If you look around you at examples of people who are incredibly self-sacrificing as physicians, I want you to really see what the costs are. I'm going to swing us a little bit. That got pretty heavy, and it is a very real challenge that we experience. But I also want to acknowledge that we've got some lesser challenges, lesser situations, right, where we can have an impact. And I want you to see how you deciding that you're going to set some boundaries around other people's messes really will help everyone, even though there can be some short-term pain. So let's acknowledge, right, that there are times when only you can fix something, but there's so many other instances where other people are just relying on your excellent problem-solving ability, and they're using it as a way to not take responsibility themselves. Or maybe they don't feel empowered to take responsibility themselves. There's a lot of different ways that that looks, but let's start to see it as it's not reasonable for me to be the one who makes all of the decisions. I may need to do some coaching. I may need to have some uncomfortable conversations, including with myself, quite frankly. I may need to be very clear. And if you employ people, you may need to let some people go if they are not able to do this after you have taken, reasonable steps to get whatever problem solved that you need solved. But one thing I really want to be clear on is that we need to let go of bearing the responsibility for other people's poor communication skills. Okay, what do I mean there? I mean that if you have people around you who do not communicate well, and you are constantly cleaning up their messes, there need to be some changes made. And yes, that includes communication with that person, right? They may not be clear. This could be your boss, this could be a colleague, this could be a staff member. They need to know, especially if you are constantly going behind them and cleaning up their messes, they need to know that what they are doing is not working. Now, I hear you. Some of the time, you're telling me, hey, I've already told them that. They already get the feedback. Okay. If they have already been told and given opportunities to improve, it's time for you to set a boundary. So let me give you some examples. Let's say you have a colleague who constantly is rude to staff, belittles them, is short with them. And you can tell, of course, that that's having an impact. My job is not to flip that and make excuses and overfunction to keep those people in place. That's not my job. It's very easy for me to think that that is my job. It is not my job. Now, what I choose to do is I choose to communicate to those individual humans that I see them and I see what they are and they're not doing, and that I don't think that that communication is appropriate. I might tell them that. And that was another thing that happened this week. I'm not going to give any details, because I don't want them thinking that what just happened was okay. I don't want them thinking that someone else's poor communication skills are okay. But I also am done making excuses for that person. I'm not going to do it anymore. I want the people involved to take responsibility for themselves and to bear the consequences. So it is important to me that the humans involved know that I think that was unfair criticism and feedback, but I can only do what I can do, right? And I'm not willing to do more in order to preserve the situation because that's not really appropriate. When we are constantly cleaning up other people's messes, when we are constantly problem solving for other people, we are not giving them the opportunity to do the work and make the improvements themselves. That needs to happen in order for things to change. No one is going to look at you cleaning up the messes and think, oh, I really should make a change because I see them doing all this work over here. The healthcare system isn't going to look at you and see that you have been on call an unreasonable amount of time or that you're working, until 9 p.m. at night. They're not going to look at you and say, we really need to solve this problem. They are not going to do that. So we need to let go of that idea, right, that everyone else will see how hard I'm working and they will make adjustments. No, we need to set some boundaries and decide what we are or we're not going to do. We also need to let people have responsibility for their relationships. So if you are the person in the clinic or in the hospital who always gets questions first because you are the easy one, we need to set some boundaries there too. We need to say, this patient actually belongs to Dr. So-and-so, and you'll need to go and talk to them about it. We need to give other people the opportunity to fix their own messes, right? If Dr. So-and-so has heard that they are having a difficult time communicating with patients, staff, and they have not chosen to make improvements, I'm not going to overfunction in compensation for that. That's a boundary that we have to decide on. And again, you're going to need to decide for yourself what's appropriate and what's not appropriate. But we collectively, as women physicians, need to let go of taking on the often invisible burdens of fixing all of the healthcare system's woes and what we consider to be maybe not great care experiences from other people. It's not just other physicians, right? It's other people. I cannot fix all of those things. What I can do is I can meet someone right here and now. I can acknowledge their experience. I can say, what we can do from here is this, but I'm not going to go and take care and make up for that bad experience. I am only going to take responsibility for where I am and what I have capacity for right now. This is challenging work. It is challenging work to set boundaries. It is challenging work to set boundaries in environments where there's a lot of burnout, in environments where there's a lot of sort of hands-off. Nope, you're the physician. You should be able to manage all of the things, including, the 80 pieces of information that come into your inbox every day and the 20 to 30 patients we throw at you every day. When we keep functioning and assuming that we are ineffective because we can't keep up, we are unfortunately inadvertently reinforcing the system not fixing itself. So again, I want to invite you to set some boundaries and figure out for yourself, where am I overfunctioning? What am I going to let go of? If you don't have nursing support, right, addressing your messages, and you used to have that and you no longer do, it is going to take you longer to respond to messages, and your answers may be pretty darn short. I strongly encourage you to set boundaries and to put boundaries actually in your messages. Hey, patient so-and-so, that's a great question. I'm not going to be able to fully address that here through the portal. I invite you to make an appointment so we can talk more about it. It sounds important. Make that a phrase that you can just blow in so you don't have to come up with that boundaries language every time. For those of you who are on my email list or have been to my website, I have a freebie that's available for you where some of that boundaries language is written in. You can just copy and paste those suckers right into your EMR or however you respond to messages and be able to consistently convey, with kindness and with clarity, nope, this message needs to be addressed this way. You can respond to patients. There's messages in there to respond to staff, right? It's a very easy way to start setting boundaries and taking care of yourself, and you don't have to think too much about it. So you'll find that on my website, which is www.healthierforgood.com. Okay, that was an unexpected segue, but here we go. Working on boundaries is hard work, and it requires a little bit of gumption, I'm going to say. It requires you honoring that you are important, that your needs and wants are important, and that it's worth the discomfort of making the choice to set and keep the boundary. Those are two different pieces of work. Setting boundaries is one thing, keeping boundaries is another thing, and they both require, again, I'm just going to use the word gumption. It requires you being very clear on what your underlying drive is. If you are listening to this episode in real time, this episode releases on Tuesday, October 29th, which is plenty of time for you to sign up to do this work together with other women physicians in community with me as your coach. My new group program, Unbound, Women Physicians Reclaiming Their Lives, is starting December 1st. We're going to meet on Sundays from 5 to 6 p.m. Pacific time or 8 to 9 p.m. Eastern Standard Time. And I'm giving you an opportunity to also bring a friend. So there's a special discount price that's available if you bring a friend along so that you can pair up and do this work with our larger community, but also in community with your friend or colleague. So great opportunity. You don't want to miss that. But we will be doing this boundaries work. We will be really sinking into kind of some of those underlying beliefs that get in our way and figuring out how do we start to have internal accountability as well as, some accountability within the community, because we are going to be connected and doing this work together. I'm so excited that this program is going to be up and running, and there's plenty of time to sign up, but don't miss your chance. Again, you can head over to my website, so go there to get the boundaries guide, right, where you can get some cut and paste phrases that you can start using today. And then sign up. In the upper left-hand corner, you're going to see a little button that says Unbound Group Coaching. That's the button you push to find out all the details. My friends, thank you as always for listening. I invite you to really sink into this episode and think what is going on in your circumstances and where do you want to start making changes. Maybe we don't start with the heaviest of the heavy, but think about where am I no longer willing to clean up other people's messes. And yes, this can be at home as well. All right, my friends, until next time, take care.